I'm Dr. Erica Bove, and welcome to the Love and Science podcast. I'm your host, and also the founder of Love and Science, Thriving Through Infertility. I'm so excited you're here today. With over a decade of experience helping thousands of women just like you, I empower professional women to build their families with confidence and compassion. Let's dive in. Welcome back to the Love and Science podcast, my loves. I have a very distinguished guest today, Dr. Carolyn Moyers. She's a board-certified OBGYN, a Menopause Society Certified Practitioner, and an international fellow of the International Society for the Study of Women's Sexual Health. She's also a friend and a colleague, and she is here to talk about basically how we can provide the most personalized care and her experience working as a gynecologist, and I'll talk about her practice in a second, but working at a practice where she is able to connect with women in midlife around issues like perimenopause, like fertility, like relationship struggles, and really is able to provide holistic care. So most recently, she's the founder of Sky Women's Health in Fort Worth, Texas, where she provides expert compassionate care with all the things we just talked about. And she has a menopause masterclass for clinicians if you are listening to this as a female physician and want to hear more information. And she also has a podcast called the Sky Women's Health Podcast, which is amazing. And, basically she's on a mission to close the care gap and empower women in midlife with evidence-based solutions, which, as you know, that's what we're all about here at Love and Science. So Dr. Carolyn, it's so great to have you here. Thanks for being a guest.
Absolutely. I'm happy to be here.
Yay. Okay. So, you are a board certified OBGYN, and, I think you have a special interest in sexual health. I love talking about sex. That was one of the things that when I went to med school to be a psychiatrist, I took like a quiz of like, what specialty should you like choose? And there are a lot of like, I like to talk with my patients about sex. And then all of a sudden it was like, you should be an OBGYN. And I was like, oh God, like that. And that wasn't even on
Did
my
we
radar.
learn anything about sex in OBGYN residence?
Right. I know. Isn't that the paradox? But I think it's amazing that that's a focus of your practice. And so can we talk a little bit about, the fertility journey with its schedules, its hormones, its emotional stress, its effect on sexual health? What can couples do, in partner relationships to stay connected during this time?
Yeah, I think elephant. Let's see. Yeah, so fertility treatment often turns sex into a medical task, right? The time pressured and often disconnected from the pleasure, right? Is like, let's get this done. And on top of that, medications could lower libido or cause vaginal dryness or maybe even affect mood. And so I love to have patients really focus on intimacy instead of reproduction, like having that be the forefront and finding ways to connect together outside of the bedroom. And maybe it leads to the bedroom, and that's wonderful, right? And if we're having vaginal dryness, making sure we address that. Every vagina loves estrogen. I love to provide vaginal estrogen to anyone who needs it. And it is, not going to be statistically, significantly, systemically absorbed. So there's minimal systemic absorption. So it's not going to affect any of your treatments. It does not raise your risk of breast cancer or any cancers whatsoever. It is very, very safe. And that helps to preserve the vaginal epithelium and discomfort that you could be having. I love a good vulva balm. So like a vulva moisturizer. Solve Wellness makes an awesome one. Via and Medicine Mama has another great one called Vulva Balm. So those are some of my favorite. And then the third would be lube for any penetrative sex. And also, it has to be sex worth. We have to have sex worth having. Right? And so if we're not paying attention to pleasure, then that can make it really challenging as well. And so paying attention to the pleasure is really important as well. And I always say, if it's not an 8, don't penetrate. So if we're not aroused to the level of an 8, it's too early for penetration. But I get that in saying that, it's also a lot more complex because we are dealing with the emotional, overwhelming stress and finances and coupled relational issues in regards to the fact that this thing is not working and you're feeling like your body is broken, and that makes it really hard as well. And I think a part of this journey, having watched my sister and coached my sister through her own fertility journey, is making sure that you're in some sort of counseling or group coaching or, some sort of significant support there, because it does affect not only the individual but the couple.
Yeah, absolutely. I think that's also wise. And actually, admittedly, I've not heard of this vulva bomb. So, they always say in medicine, it's lifelong learning. And if you can learn one new thing every day, thank you for teaching that, because I'm going to look that up. It's amazing.
Yeah, yeah.
I also wanted to address, I see a ton of people in my practice, well, both my coaching practice and my clinical practice, who have significant pain with intercourse. And, a lot of times it's like that deep dyspareunia that happens when people have endometriosis. And I know you see people with chronic pelvic pain in your practice, and you're an amazing surgeon. Like, what do you think about that aspect when, like, you know, of course, if somebody's doing IVF, that then that takes that piece about it, but people still want to be able to connect with their partners, or say they're like having sex to try and they're not doing IVF at this point. And like, what do you tell people who have that particular struggle in terms of how to make that aspect of life better?
Can you repeat that part of the question before I answer it? I want to make sure I understand what you're asking me.
Yes, elephant. So for people who have dyspareunia and even like deep dyspareunia, say we fix the vaginal estrogen issue, but like people who have it due to structural problems or endometriosis, how do you help people who are having, pain with intercourse to get that aspect of their lives better and working again?
Yeah, so pain with sex is a big issue, right? That we women also often just like get through the deed. A lot of times they just kind of push through and don't address what's going on with the pain. And so we have to understand what's the source of the pain, right? So we have different zones. And it could be that it's nerve related, that it's the skin of the vulva. That's why we talk about the moisturizer and the vaginal estrogen and all that. It could be that it is related to the pelvic floor muscles, and we might need pelvic floor physical therapy. It could be that it's uterine pain, right? So from other diagnoses like adenomyosis or endometriosis or an ovarian cyst or an endometrioma, there's so many different aspects that could be creating pain. And we know that the degree of endometriosis does not correlate with the level of pain. And so, sometimes I've been in the pelvis and been like, oh my God, this person's never described any pain and they've got massive endometriosis. And then other times when people have severe endometriosis, and you might find a little hint here and there. So the two do not correlate. We all experience being different. And then there's also even lumbar spine. So we have to look at all of these different regions as to what could be causing that pelvic pain, and then addressing it from a region-based approach. Um, so I oftentimes it's a multifaceted approach, right, to addressing that. And then we also can't uncouple that from a history of sexual abuse, or not feeling safe in a relationship, or body image issues, right? That are all reasons that can impact how we show up, or whether we want to show up naked, right? And a lot of times with body shame, I remind women that our partners are delighted that they get to be in the room when we're naked. Like, we are so much more critical of our bodies. And if our partner is being critical of our bodies, then maybe we've got the wrong partner. Like, there is something that might need to be done here. But majority of the time, our partners are just delighted that they get to be in the room when we're naked. And so we can remove some of that burden that we put on ourselves from society, that we're supposed to look a different way. We're shitting all over our sex lives. It should be this way and it should be that way. And I should be able to respond in this amount of time, XYZ. So being able to be present, an orgasm happens in this fine balance between excitation and relaxation. And so if we're in this fight or flight, stress, hypersympathetic situation, it's going to be much harder for us to drop into our bodies and be present and engaged. And this is true for people who maybe are stressed at work, or they're stressed with the duties of the next day, or they're worried about the dishes in the sink, and taking time to be present in that situation, and let the rest of the world go, and be much more challenging as we age and we add to the burdens, And a lot of patients are like, well, it's not like it was in my 20s. Well, you have a whole hell of a lot more responsibilities than when you were in your 20s. You know what I'm
Yeah,
saying?
right. Yeah. And most of my people are like, attending physicians and they're like dealing with call schedules and sleep. And maybe their partners are in medicine and their call schedules aren't matching up. And I think we can't ignore the practical factors, but I think you're right. I think we need to look at the emotional context if there's anything emotionally body image trauma, which would make it harder to be present, but then also think about it from like a regional standpoint. I will say I have massive respect for pelvic floor physical therapy. I think that we hold trauma in our pelvic floor. And
Absolutely.
you see a huge connection between people with a history of trauma and endometriosis. And I don't think we've quite worked that out scientifically yet, but I think the two exist. And so, yes, I am very liberal with giving people a pelvic floor physical therapy referral to say, like, let's see if part of this is actually musculoskeletal, because just like the end of the day, my shoulders are on my ears because I've been at my computer and stressed, and I need to
Yeah.
consciously relax those muscles
Yeah.
sometimes. And we can't do that without a guide. And we need somebody to help us like make those neural connections to relax our pelvic floor. And hey, we still might need endometriosis surgery. We might need other things, but that's a very low hanging fruit that I think can really improve people's sex lives, that is just like not talked about enough. If you're listening right now and finding yourself nodding along, this is usually the moment people realize that they want support that's specific to them. In addition to this podcast, I offer one-on-one fertility consults where we look at your full picture with both strategy and compassion. You can learn more in the show notes. Now, let's get back to the conversation.
Absolutely. I adore pelvic floor physical therapy and for so many reasons. Like, first and foremost, when we have a pregnancy and we have a baby sit on our pelvic floor for 10 months and then we birth it through our pelvic floor, or we have a C section and then we act like we're supposed to bounce back at 6 weeks. I mean, obviously, a male came up with that theory. Like if a baseball player has a shoulder injury, they are going to be rehabbing that shoulder for 3 to 6 months. Why would we not do the same thing for the pelvic
Yeah,
floor?
yeah, yeah.
And also at the other aspect of just like in the menopause transition and having lower hormones and having more stress, and maybe patients who clench their jaw oftentimes are clenching their pelvic floor and they don't even realize it. And I think about one patient in particular who was in menopause, had severe pelvic pain that had originated in the last 5 years to the point that it was interrupting sex, and was
Mm,
very distressed by this. And listening to her and taking a detailed history is always important because patients will usually tell you what's going on. That is very difficult to do in our standard medical system, where you're having to see patients in 10 to 15 minutes to keep the doors open.
mm-hmm.
You're being told, RVUs, we need more, we need more, we need more. Um, but luckily in my practice, because I don't take insurance, I have all the time in the world to really listen to patients. And so this particular patient, we did a detailed exam, and my exam has changed since my involvement with ISHWISH because I've learned so much more about sexual health. And so we're doing a Q-tip test to the vulva. Where does it hurt? Right. And then with one finger, I'm doing a digital exam to the pelvic floor muscles. And with this particular patient, we identified that she had a hypertonic pelvic floor. She went to pelvic floor physical therapy, and oh my God, like she's moving to New York City and she still plans to come back and see me. Like that's how devoted she is at this point, because she's like, I cannot believe that you figured this out. And now she has pain-free sex and she's on her hormones and she's feeling great and she's thriving and she got a new job. You know,
It's
it can make
amazing.
all the difference in the world to
Mm-hmm.
just find out what is that origin of pain. It's so much more than just like sex hurts, right? And then if it's deep penetration and it's something related to, the uterus getting bumped with that deep penetration, that cervix gets hit, then something that you may not be aware of is called O-nut. Are you familiar with O-nut?
I'm not
So it's all
actually.
one. Be careful, guys, what you search online. O-nut is all one word. O-nut. This is made by the pelvic people, and they're basically little silicone squishy devices that just get dropped onto the penis, and you can stack however many you need. And it allows you to control the depth of penetration.
Oh,
So if that's too deep, then we're going to try two. We might need three, right? So you can stack and control the depth of penetration. It's called ONUT. It's so cool. It's little silicone,
oh,
medical
that's
grade
interesting.
silicone that you just stack on the penis.
So do the men, I mean, I'm curious, like, is there feedback from the men on their experience with this? I mean, again, I think we are always so focused on the male's experience of sex, which is just interesting in and of itself. But like, I'm curious
Yeah.
if somebody's like, like IUD strings, is this going to affect my partner's experience? Like, what is there any
Yeah.
data on that, or what do your patients say?
No, I don't know. I don't know. Elephant. I don't know of any data on it. It's something newer, like in the last couple of years that's come to my attention. Um, I will say that some patients will be like, "Oh, I know that my partner won't be down with this," but I mean, they're getting a little squeezed too, so I don't know why they would be opposed to trying this out.
Right.
Um, Many patients are just relieved like that they have some locus of control in that scenario because maybe it's not at entry. Maybe it's not that the vaginal walls are dry, but it's just that depth of penetration. And if they can be in control over it, then everyone gets to enjoy the experience
Yeah.
more.
Oh, that's fast. I just love that this technology is evolving in this way. And, I think you're right. Like to be ISHWA certified is like a huge feather in your cap because it just provides so much more comprehensive care and also combined with the time that you have to be able to like listen to people. I think sexual health is like the first thing to go when people are taking a history because they're like, oh, that's extra. But I think if we think about how much that sexual health affects the rest of our lives, our health and our lives. So, right. So maybe it's not that there are problems in the beginning, but then people start on this journey of the fertility journey and then sex is work. And then, then men develop sexual dysfunction, women develop pain. And, I
Yep.
actually was thinking about this, as you were talking about like the effect of pregnancy on the pelvic floor. I don't know if anybody's ever studied the effect of having grapefruit sized ovaries. Maybe some people have done 2, 3, 4, 5, 6, 9, 11. I mean, I know people who have done that many IVF cycles, and you think about what are the effects on the pelvic floor of the ovaries getting that big, even for 2 weeks at a time, 2 weeks times 11, that's like almost half of a year, right? And so
Yeah.
just thinking about the effects of maybe it's not just like the pregnancy process, but maybe there is an effect, a deeper effect on the pelvic floor throughout our IVF stimulation. I've not seen data, but it just intuitively makes sense to me as we're talking out loud about it.
Yeah.
That's so
Yeah.
fascinating. Well, one thing I also wanted to highlight as we're talking about like sexual health and fertility journey and how couples can sort of go apart from each other. One thing I will say I appreciate about you, and this is also myself as a divorced person, right? Is like you have a wonderful relationship with your own husband, and so I was wondering if you can share with the audience, like you've certainly had ups and downs in your life, like this entrepreneurial journey, right? Like your husband's been widely
Yeah.
supportive. Like, what are some ways that you connect together? I mean, not even, I'm not talking about like in the bedroom, but I'm talking about like what are some ways that you guys stay connected throughout life's phases, throughout ups and downs that might be helpful to our listeners who are maybe feeling disconnected from their partners or spouses?
Yeah, I mean, that's a great question. You asked me to be really reflective here. And it is my second marriage. So yes, I do have a wonderful marriage. Uh, Elephant. I'm gonna think about this a
I
minute.
didn't know this was your second marriage. That's amazing.
Hmm. Hmm.
Huh.
So I did have a starter marriage. As my attorney when I was going through my divorce said all of us have a starter marriage, right? Um, and and that fell apart in my intern year of residency,
Ooh,
which everyone knows is a very stressful year to begin with. And I had a toddler.
oh my.
Um, so real challenging time. And I don't know that there's anything that I could have done to save that marriage because I was working so hard to overcompensate for all of the things. And you have to have a willing partner. So
Yeah.
there's that, right?
Yeah.
And we're not always going to pick the right partner the first time, right?
Right.
So I took a lot of years to work on myself and to do my own personal journey and counseling and travel and discovery, etc. And several years later, I met my now husband. And How do we stay connected? Talking is really important and really key in talking about the hard things. And like you, I love coaching. And so I've done so much coaching through Empowering Women Physicians to MoneyFit MD. And then I did Latifa is Akande is just awesome. So several money things. And that was my big barrier in talking with my husband. And it's so funny because when I finally had an intimate conversation with him about money, and you don't think about money and intimacy, but let's be honest, she finally was like, okay, I think our work is done. that was
Wow.
that was my big barrier.
Huh.
So it's kind of interesting, right? So I think that having open communication is really important, and also that interpersonal independence, right? So I allow him to be who he is, and he allows me to be who I am. I recognize when he's in his cave and he needs time to think. Um, and also, I need time to be social, to be out and about. Those are equally important aside from the time in the bedroom. You know what I
Mhm,
mean?
mhm, mhm.
Coming together to communicate about how we're going to navigate all of the things in regards to life, from managing a household to groceries to, remodel, like whatever, is going on in life. There are plenty of stresses. That we can navigate. And it's not always easy, but always coming back to that why and remembering how well matched we are, and that feeling of safety in a relationship that I've never had except for in this relationship. And so sometimes things trigger me and I go into fight or flight, and it's not even his fault. It's from past experience.
Yeah,
And so I have to calm my nervous system, or he reminds me that this is your first marriage, you know?
it's helpful.
Yeah.
So I think that's all very, very helpful. And I think one thing that I hear from my clients a lot is like, well, my husband can't be like the bearer of all of this. Like it's just too much for him and he processes things
Yeah.
differently. And so I mean, I think there's a huge role for like female friendships and female communities.
Oh, yes.
It's hard because I think that many people who I interact with, they're the only one in their group of friends who hasn't had a kid yet or is like having secondary infertility. And so that is really hard because they're like, well, my friend group, like nobody gets it. And I actually am alienated from them now because they keep saying insensitive things and only talk about their own children. And
Oh,
so what would you say to the
mhm.
person who feels like, yes, I want to be close with my husband, but I'm like always sad about this. And he doesn't seem to understand, he's so positive and he's so hopeful and
Yeah.
just says it's going to work out, but like I'm really concerned and I feel really threatened and I don't have anywhere to bring that where I feel like I can uh have that sense of safety.
I think that the male partner probably has the same sense of worry, but is probably trying to be strong for his wife because that's
Yeah,
men's role, right?
yeah.
I think that some of that is probably there. And so the thing that I'm always blown away by is that when I allow my partner to show up for me, he does. But when I put the past experience on him, or the worry, or my own thoughts on him, it usually doesn't work out well. But whenever I allow him to show up for me, and something as simple as like taking the groceries in from the car, like just that's a small aspect of how he can show up for me. But there are so many ways that your partner really does want to show up for you. And
Yeah.
so being mindful of that, I think, is key. But also I think having a group of women that you can rely on. I mean, like my sister went through infertility. I was very understanding of her and supportive and helping and coaching as much as I could to her and her husband. But I can see how in a friend group when they're birthing babies, very triggered. I mean, my sister-in-law left a family dinner, whenever we announced that I was having my second son, because it triggered her, because she
Of
went
course.
through infertility, right? She
Yeah.
left the dinner, and others were angry about it. And I was like, I get it, like we have to have some grace and understanding for people who have this intense longing and
Yeah.
don't have the support that they need. So, groups like yours where they can have
Yeah.
support and understanding.
Yeah, I think you're right. We all need safe spaces. And, I know that you found yours, which is like so beautiful. And I think that's what I'm really trying to do at Love and Science is to create a community where people can feel safe, they can feel understood. They're not worried that people understand the triggers. And so, it's sort of like a safe space. And I think just watching your sister go through that, it's a challenge, right? It's challenging when one person, I have a whole podcast series on it, when one person is having struggles and the other person isn't, and that might just be a sort of more disconnected period of time, and like holding space for that person and showing up how, just ask them, what they need. I think that's the most important thing. I have a family member right now who's going through it, and I said, hey, even today, would you like to have dinner? And I said, I understand if that doesn't work for you for any reason. And she said, no thanks, but thank you, let's try again next month. And so sometimes just like checking in and being like, hey, I really care,
Yeah.
I'm here for you. I think that makes a lot of sense. But I think I think you're really right about like allowing what you said about your husband, like allowing yourself to receive and allowing, I forget exactly how you said it, but like show it, like allowing him to show up for you. I think that's what you said.
Yeah.
Because I think about, so many high achieving female professionals,
Mhm.
doctors, attorneys, engineers, it's a very masculine energy we need to have to do our days. And I mean, you found a way in your practice where like I know that there's so much beautiful feminine energy. Like I can just tell from your gorgeous office and
Yeah.
the time that you
Yeah.
spend with your patients. Like it's a very feminine practice. But I would imagine when you're in the OR, there's more of like that masculine energy that comes out because that's sort of
Yeah.
the required
Got to be
energy
in
for
charge.
that
Yeah.
space. Exactly. And so one thing that I try to help people with is shifting from that very like I'm in control, I'm the one, like that doctor persona or that
Yeah.
CEO persona, to being like conceiving as a receiving event, whether it's an embryo that's
Yeah.
placed in, whether it's getting pregnant outside of IVF. Like we have to learn how to receive. It's an energetic shift that nobody teaches about in medical school or OBGYN residency, but like I say this from the rooftops, conceiving as a receiving event. And the more we can soften in our lives, the more we can allow others to show up for us, the more we can receive, like literally receive. It's a more vulnerable position, but it's
Yeah.
one that keeps us engaged in meaningful relationships because we do need to receive at times, and we are givers and we're receivers. That's the beautiful thing about the universe, is this like dynamic that happens. But I think by your allowing yourself to receive in the context of that relationship, that then it just energetically is very healthy, and it allows you to express all aspects of yourself. Your husband has a role, right? And I'm so inspired by this relationship, even more so as a divorced person, because now I know it's your second marriage and that gives me hope for myself. But no,
Oh my God,
truly.
there's so much hope. I just say, oh, you have to be willing to wait for it though.
Yeah, yeah, no,
Yeah.
patience is a virtue. I'm very
Yeah.
patient.
Very
um
picky, very picky. I feel like a second marriage can be better because you really know what you won't
Yeah.
tolerate
Yeah,
anymore.
yeah, yeah. And I will
Yeah.
say I do have a lot of patients and clients who are on their second marriages and they feel like they've sort of quote unquote wasted their fertility years on like the wrong person. And
Oh,
I,
that's
I
hard.
it's
Yeah.
so hard. And I think like that's where we bring in like the self-compassion. That's where we bring in the forgiveness. Like I made the best decisions I could at the time. Like I could have gotten divorced my intern year, but I truly felt like I didn't have it in me, so it's like we just have to have compassion for ourselves that whatever
Yeah.
decisions we made were the best decisions we could at the time. We can't blame all fertility on age concerns because we know that's only part of the story. And when we can start receiving, when we can soften, when we can bring in that feminine energy, that is when I start to see the treatments start working better, the relationships start getting better, and it just feels better to. It's scary. It's scary. It's not easy to be vulnerable sometimes, but I think when we can embrace that side of ourselves, I really see that beautiful thing start to happen. Thank you for bringing that up. That's amazing.
Absolutely. I feel like, as women physicians, or in high CEO performing positions, we feel like we have to have it under control at all times, and we are overcompensating for being a female in a male dominated role. And so I do feel like sometimes that's hard to turn off at home, right? That's hard to need someone else. And that's a very intimate thing,
Yeah.
right? To be able to give into needing in that relationship, that can be very scary, especially if you've had past trauma or concerns, or you're worried about, are we going to be able to have children? I mean, my husband and I too. I didn't necessarily have to have another child in that marriage. And I actually entered it going like, yeah, okay, but I have one, I'm good. Like there was no like, need to have a Brady Bunch or anything. But ultimately it did become a concern in the first year, like, oh, we're older. I mean, I would be advanced maternal age. Are we going to do this?
Yeah.
Is it going to work? There's always that concern. But being able to be vulnerable and be intimate with your partner, I think only enhances that connection.
Yeah. Which again, how we do one thing is how we do everything. And so back to our bedroom conversation, we can allow ourselves to receive in that context as well. And
Oh,
like I say to my people after IVF cycle, like, no penetrative intercourse, but you can be intimate. And so play around with
in so
that.
many ways. Yeah.
So many like orgasms are not off the limits. And so just to go have fun, like
Yeah.
give your
And
partner.
can we, yeah,
Yeah. Go ahead.
I didn't mean to interrupt you.
No.
Yeah, I was just going to say the majority of women do not orgasm with penetrative sex, anyways.
Thank you for
So,
saying that. Yeah.
yeah, I
Yeah.
mean, the clitoris has 10,000 nerve endings. We only see the tip of the iceberg on our diagrams, right? She dives
Yeah.
behind the vulva.
Yeah.
There's
Yeah.
plenty of erectile tissue there to
Yes. And
stimulate outside of penetration.
all those instructions from your fertility clinic that say no sex, that does not mean you can't be intimate and have really awesome intimacy and amazing orgasms and all those things. And so just to bring it back to that, receive in the bedroom, receive outside of the bedroom, and almost like just sort of just make it into a little like fun challenge. Like let's see all the ways that we can have fun that doesn't involve this one particular act that my fertility clinic says I can't do for this much time. So anyway.
Right, right.
Okay. I wanted to ask you a question. So you are an osteopath, and I have the greatest respect because I almost did sort of a Eastern program before coming, and I'm very much into like we have to look at all the modalities. How do you think that being an osteopath has informed your ability to provide the highest quality OBGYN care to women?
That's a great question. So I applied to all the schools in the state of Texas whenever I was applying, and it was a part of a system. Uh, and so interviewed at allopathic and osteopathic schools. There was only one osteopathic school in the state of Texas, and it's just where I matched. And while the principles, may be slightly unique or maybe different conversations that are going on in allopathic schools, the hands-on skill set is, like the kind of feature that makes us slightly unique. And I was finishing my second year, so your first 2 years of those core class rotations or lectures, and going into rotations, and I felt like I think I could finish osteopathic school and really not understand this skill set that makes me unique, right? And so we had an opportunity to do a fellowship in osteopathic medicine. And so I did an extra year of medical school and
Oh,
got a
wow.
master's degree. Actually, got a master's degree in clinical research and education and finished this pre-doctoral fellowship. And that just gave me such a more broad understanding of what can be helpful in osteopathic medicine. It's more than just the hands-on, the body can heal itself. We have a desire to come back to homeostasis, and the hands-on musculoskeletal techniques. But I think that it just was in line with how I thought about health and wellness.
Mhm.
Um, and maybe it's caused me to be a little bit more stubborn against the system because, whenever I practiced in rural health is where I started after residency. I did a rural health commitment to pay for my student loans. And I loved it because I was lower volume and had more time with my
Mhm.
patients. And that's
Mhm.
just how I thrive. Now, I remember when we moved to the city, trying to figure out what to do and did some hospitalist work. And there was one particular group who was just so kind to me and they tried to recruit me, God bless, but it's just so much different than in rural setting versus the city. And um, I was sitting at one of the doctor's desks doing some work and saw her schedule for the next day and literally 40 patients. And I thought, oh, never. I don't know how I can compassionately see that many people or document on that many people in a day.
No, no.
And so now, and with Sky Women's Health, this was born out of this desire or this belief that I deserve better for the medical system and my patients deserve better for the medical system.
Yeah.
And it is saddening to me and also exciting to me whenever patients say, nobody's ever explained it like that to me before, or that I finally feel heard and seen in the medical system. It's just so disheartening to know that women are feeling rushed and hurried through their care, and like nobody really gives a shit.
Mhm.
Like,
Or they're just
who's
trying to get through their
listening to
day.
me?
They're just trying to get through
Yeah,
their day. And it's not
yeah,
because they're not well-meaning people, but it's like the
yeah.
structure does not allow the highest
It
quality of care.
doesn't
And that's,
allow.
yeah, and that's what I say about the coaching is like I have the luxury of time. And so we will spend as much time as we need to go to the deepest layers
Yes,
for the
yes,
healing, not just
yes.
the medications, but like the deep healing that happens.
Yes,
And so
because it is emotional, spiritual,
yes,
physical. Yes, so
yes.
you have to take all those aspects into consideration. Yeah, so I kind of love that I'm an osteopath now. Initially, I had a little complex, like, am I good enough? And we have to, overcompensate. But I'm totally over that now. I love it. And I think my patients love it. And because I give each of them so much, like I put my whole heart into it in a day. And because patients experience that in the room with me, nobody complains if I'm running behind
Right,
because they know that it's for good reason.
right,
Something
right,
has
right.
happened just for good reason. And
Mhm.
when I get to you, you're going to have my full attention. So, um, I love being an osteopath. I think that it's fun now to be able to incorporate my osteopathic skills. So this is interesting that I really didn't get to use it in my first 10 years of practice because, in a traditional insurance model, you don't have time. You're doing emergency OB department care. You don't, occasionally you might get to, but then the beds in the room aren't really great for it because you need a sturdy bed. And so then I have to take them to the OR to have a sturdy bed. I have put women's ribs back in place in the OR
Oh
before.
my goodness. Wow.
Yeah, they'll just drape the bed so that we can use it and then get out of there. But
Oh my gosh.
um, it's really interesting because I did that fellowship, it's so comfortable to come back to it and to see the results for patients. It's really remarkable. And so my OB colleagues will send their pregnant patients to me to do osteopathic treatment because we all know pregnancy is uncomfortable. And if we've had a car accident or motor vehicle accident or horseback riding accident or sports injuries in the past, it
Yeah.
just kind of compounds it. Um, but then also for my surgery patients and postoperative follow-up, and for my members, they come in for a quarterly OMT. And I have one who she's just like, yeah, I'll pay an extra $100. I just want my OMT, like every couple of weeks.
Oh, that's so amazing. I mean, I see this Sky Women's Health as just being like the confluence of all of your ninja strengths. And I'm just so
Yeah.
grateful to see it grow and thrive. So I'm sure my listeners want to know where can they find you? And by the way, I have a sister who lives in Grapevine, Texas. And so my own sister needs to find you. I will point her in your direction. But where can people find you? Your website, and we'll put it in the social, in the show notes as well.
Yeah. Yes, skywomenshealth.com is my practice, and we're on social as well. At Dr. Carolyn Moyers is where I'm most active on social. I also have a course for any medical provider who wants to know about how to the nitty gritty of how to actually counsel patients and treat patients in the perimenopause menopause transition. All the details are there with links to my own podcast and links to all the critical articles that you need to be apprised of. And that is at drcarolynmoyers.com.
Amazing. Well, thank you so much for sharing your story. Thank you for doing what you do, for healing the world, truly. And thank you for being a guest on the podcast. I can't wait for our listeners to hear our conversation.
Absolutely. And they can go listen to my podcast. I
That's
forgot to
right.
say that.
That's right.
Yeah,
Yes,
Sky
yes,
Women's
your
Health.
podcast.
Yes.
Yes, yes, yes. Okay, my dear. And to my listeners, I love you. Until the next time. Bye.